I first met Courtney right after surgery, so she was a little bit sleepy. We were consulted initially because she needed a cervical collar for her neck for stability after surgery. And then after that, we worked on activities of daily living, like getting herself dressed, getting up, going to the bathroom safely, standing at the sink to change her collar back and forth. And we did a lot of family education with her as well. We also worked on with her sitting in the chair, getting her socks on, because that's a little bit challenging when you can't bend over to do that. Also, I went over with her and her family how to change the cervical collar, because you wear one during the day and then another one you change to take a shower. For most of Courtney's life, she was independent. As you probably know, she was playing basketball, extremely active. So then she had the surgery and some of her independence was taken away because of her precautions, such as she couldn't bend over to reach her feet. She'd have to bring her legs up to her hip to put her socks on, different things like that. So it was challenging for her, I'm sure, because she just had to learn how to adapt and compensate for natural things she was used to. In addition to her occupational therapy, she also had physical therapy. They worked on getting her used to sitting up at the edge of the bed, progressing her to sit from the edge of the bed to the chair, and then they started ambulation with her. Initially, she was using a rolling walker, and then she progressed to using a cane, and that's what she was discharged home with, the cane. And then after she was home, she was walking on her own. And now I hear she's coaching a basketball team, so she's walking just fine. Family education is a huge part of our therapy. It's really important if patients have families that they come in and we're able to meet with them, because we do a lot of education of how they're able to help the patient once they get home, because we're not there with them anymore. So in Courtney's case, for example, she was fit with the cervical collar, and we taught her family, because changing a collar for her is kind of tough, standing at the sink, reaching up with both hands. So her mom learned how to switch the collar back and forth, and also learned how to help her safely take a shower at home and transition. Our focus is always helping patients become independent again, or back to their baseline level, whatever that may be. And it's nice to know that you're helping people with their life skills to get back to their independent level.